Good evening, everyone. So I welcome you all on behalf of Delhi Homeopathic Medical Association. Welcome you to the webinar on the topic Roots, Mastering Keynotes, Efficient Strategies for a Busy Practice. This is to inform one and all that Delhi Homeopathic Medical Association. Am I not audible?
Your voice is quite low.
Okay. Start again. Welcome everyone. I, Dr. Garema, on behalf of Delhi Homeopathic Medical Association, welcome you all on the webinar on the topic Mastering Keynotes, Efficient Strategies for a Busy Practice. This is to inform one and all that Delhi Homeopathic Medical Association was established in 1932 by Dr. Yudhvir Singh. Dr. Yudhvir Singh sir was the first Health Minister of Delhi. Nehru Homeopathic Medical College and Hospital was also founded by him. Along with Delhi Public Library and NHMC, he found many other associations for homeopathy. He was the first chairman of Delhi Homeopathic Board. DHMA has been working for the welfare of homeopathy since 1932 by various means such as organizing camps, seminars, national conferences, CMEs. Continued meditations are held in Delhi Public Library on last Sunday of the month, and webinar series was started during COVID, and more than 250 webinars have been organized during COVID times, and webinar series has been conducting since that day. And every Sunday of the month, second Sunday of the month, 9 p.m. exclusively for DHMA members. So I feel honored to introduce our speakers. We are honored to have you, Dr. Ranjan Belsare, sir. Dr. Ranjan Belsare is a classical homeopath practicing since 9 years in Varud, Amravati. He graduated from TSHMC, Amravati with flying colors. He was a gold medalist in 19th Summer School of PGNH Nagpur. He completed his MD in pediatrics from National Institute of Homeopathy, Kolkata, where he learned from very senior homeopaths. He is a busy practitioner, seeing in his town, seeing almost 100 patients per day and still finding time for us. Thank you so much, sir. He's also trained under international homeopath like Dr. Farooq Master. He was awarded with Young Achievers Award for his contribution in the field of homeopathy. Homeopathic Youth Icon Award at Ahmednagar. And he has conducted many seminars on different subjects. Along with this, he is a teaching faculty in Khandala, homeopathic workshop conducted yearly by Dr. Farooq Master, and faculty in PGNHI Nagpur. And currently, he is motivating and teaching many homeopaths through his cases from various social media platforms. So, and there's instruction for the listeners. Please ask your questions at the end of the session, or you can type them in the chat box. Don't interrupt in between. All the questions will be taken in the end of the session. And now I seek permission from our President, ma'am, so that we can proceed with the webinar of the day.
Yeah, thank you. Thank you, Dr. Garima, for the beautiful introduction of Delhi Homeopathic Medical Association. I welcome all the participants and especially welcome our honorable speaker, Dr. Ranjan Belsare. Welcome, sir, to our platform, Delhi Homeopathic Medical Association. We are very pleased to have you today. Thank you so much. Over to you, Dr. Garima.
So you can please proceed with the session. You can start your screen share. And we'll be here throughout the session for any kind of assistance you need.
Okay. So am I audible?
Yes, sir.
Can I start my presentation now?
Yes, sir. Yes, please go ahead.
Okay, so thank you so much, Delhi Association, for the opportunity you gave me to present some of my experience from my clinic. And I thank Dr. Niharika, who introduced me to the group, and she is one of the main reason I'm here. And she especially told me talk something on keynotes. For me, keynotes was really a life-changing and enlightening journey, because I came from Maharashtra, and I don't know how daily peoples are practicing. I heard a lot of peoples follow Dr. Segal's method and other method. I might be wrong. There are these type of what can I say, myths and facts and propagandas are being spread, that these people do like this, these people do like this. But in mainly in Maharashtra, we don't know much about the keynotes. And when went to study for my PGs in the National Institute of Homeopathy, I see that uh, how efficiently and how correctly the patients were being tackled, and with patients being prescribed with the help of Alan's keynotes. In NIS, we have almost a daily OPD of 2,000 to 2,500 patients. That means each department will get more of 300, 300 to 400 patients per day. With the limited time, you have to we have our postgraduate classes after the OPD, so we have to finish it before 2 or before 3. And that time I saw my guru, Dr. Adhikari sir, who was an excellent prescriber, who will prescribe on being look at the patients. One day a patient came to the OPD. I can decide few my experiences, and how I got fascinated, because I was not from the background of keynotes, and we all know from Maharashtra. I'm from Maharashtra. The Bombay School of is very different from the uh, other schools, because we practice mostly on the mentals or on Kent or other sites. So being a part of the we can say Kolkata school was very different, and that was very enlightening for me. I went to the OPD, and my Dr. Adhikar sir was there, and he was seeing a patient of caries of bones, who was a patient who was not getting better. And the patient came from a very rural area. He visited some allopaths and that of that time. And sir, look at the patient. And my boss, my senior, Dr. Sumit Jaiswal, Sumit Paliwal sir was there, and he presented the case. And sir instantly said, give him acid fluoricum. How and how was that? Because we don't have that much time for each case. We have to take the case within 5 or 10 minutes. We have to present it to sir within 1 or 2 minutes, and sir will prescribe on that. And see, and then sir told that look at his face and see, you will find the foggy glabella. The glabellar region was swelled, and and then he showed me his tongue, that his tongue was cracked in multiple directions. And see in the Allen keynotes that the acid fluoride is one of the best remedy, one of the great remedies for the caries of bones and necrosis and other things. And after prescribing that, and for that type of disease, he prescribed within 1 or 2 minutes. And in the subsequent follow-ups, the patient got better and better. And I was astonished, and that was very new to me. And then somehow was very intrigued, and I was very much interested in the Allen keynote. Before that, we only used to study Allen keynotes for the MCQ purpose, and to to get rid of those hectic online and comparative exams. But when I looked to the Alan Kinos in this way, and how Kolkata peoples, and how my guru Dr. Adhikari sir was using it. It was marvelous, marvelous, marvelous. And that's how I found that they can treat and cure, I can say, so many patients in so much less time, because we have only 4 or 5 hours, and you have to treat 300 to 400 patients. So it's not an easy task, and with that much of accuracy. So that's how I got acquainted with the Allen keynotes. And that's how what I'm doing in my practice. I uh, on daily basis I see near about 100 patients a day, and that's a hectic task. You have so much limited time to prescribe upon, because I'm a rural area practitioner, and I practice in a what can I say, in a town way, tehsil place, where the most of the patients are from the rural areas and who didn't give that much history. Many times, sometimes they will give excellent history. The task is very much easy, but sometimes the task is so much difficult, so that you have to have something in your sleeves to tackle that type of patients and that type of cases. So Alan keynotes has very handy for me for in my this clinical journey. I recently completed 9 years of my clinical practice, and that was one of the biggest tools I have that I use in my clinics in a daily day, and with that which I'm going to share with you. Uh, for me, many students ask me how to study mathematics, because I am an ardent follower of mathematics. I use very less. Uh, wait, Valo. Wait, Valo, go there. Baba is working now. Okay. Baba is working. Go there and close the door, Valo. Okay. Just 1 minute. Uh, go outside now, Valo. Okay. I will come to you. Okay. Wait. Uh, so sorry for the interruption. My daughter came. Uh, that was Ravi. I I am an ardent follower of Mathematica. Some say they are a very good repertorian, some say they are classical prescriber, but for me, Mathematica was always a choice, because I find Mathematica so complete and so fulfilling that you don't have to manipulate, you don't have to interpret, you don't have to take the patient symptom to another level. It is what it is. For me, that's why I found Mathematica as a solid base, and I follow Mathematica day to day, rather than the repertory or rather than the other methods in my practice. So the way for me to understand the Mathematica is always the uh, comparisons and differentiations. What Dr. J.H. Allen had told, that if you want to study the Mathematica, that's what I told to my student, that the isolated study of the drugs of homeopathic mathematics is a meaningless exercise. If you study your drugs one by one, I will read that one drug from this one mathematica, and then from other, and then from it is a meaningless exercise. You will forget all the informations you have collected within 1 or 2 days. You will be very much excited that I found that much amount of information about this drug, but at the end of the day, you will keep forgetting it. Okay. For the best way to remember the mathematica is to compare it with the surrounding or the similar drugs, and that's how Dr. H.C. Allen has done with the Allen keynote. So when the very striking symptoms in the mathematica came, he gave the possible similar remedies which can also cover this symptom. For example, if you see the map tongue, we will see nitric acid, we will see taraxacum, we will see sanicula, but how this tongue is different from other drug, he also gives. If the tongue is more of with the kind of ringworm, the most close remedy is natramine. Okay, so that's how he had different. Now we can never forget for how now we didn't forget now that What is the natural mood tongue? Okay, so there are many instances in the Allen keynote. That's why the Allen keynotes is one of the best book to remember. You can remember it by differentiating it. Okay, that's why Allen keynotes. And Dr. S.C. Allen, in the introduction of the Allen keynotes, he said that, okay, the life work of the homeopathic mathematical students should be constant comparison and the differentiation. If you see, we have nothing to do rather than comparing and differentiating our drugs. If we do that, then we can remember the mathematica for the longer time, and most of the time it is very ready to use for us. Okay. Let's go something behind the scene, how why Allen keynotes and how made. I can say that when Dr. Hahnemann was there, Dr. Hahnemann mostly relied upon the Puritan group of, he was more Puritan group of follower of Mathematica, from where Puritan means those symptoms which are came directly from the provings, not by clinical experiences. These are came from the provings, and that's how Dr. Hahnemann was practicing. And the most of the what can I say, the homeopaths at that time was practicing. That's why we have this long cases, and this what can I say, the symptoms we never heard of. Okay, if you see, if you read a preamble of Mathematica Pura, he gave a case of bryonia, and when you finish the case, we finish the article, until the end, you never know that the medicine is bryonia, because that was so much Puritan symptoms, and that was so vast symptoms, and we will get lost in that. Many times we get lost. That's why at the end of the time, Dr. Hahnemann also needed the repertorial version of this Mathematica Pura. After that came Dr. Herring, who was one of the biggest contributor of the clinical Mathematica, plus the toxicological sources. Many times he took the symptoms from toxicological sources. If you read Dr. Knir's autobiography of Dr. Herring, the symptom of angioedema didn't came in the proving of apis mellifica. In apis mellifica, we see that there are baggy swelling under the eyes. We have angioedema, whole swelling of the eyes. It didn't came in the proving, and it can be came. It didn't came in the proving. It came when Dr. Herring traveled more than 70 kilometers to see a patient of honeybite, bee sting. A patient was bitten severely by bees, and now, and he received a mail or at that time, and he saw that I am going to see that patients, and after that I will give the medicine. And now after he carefully he noted the symptom, and he uh, uh, added in his mathematic, and that's how the Herring guiding symptoms came, which incorporates the Puritan, the clinical, and the toxicological sort, which is denoted by theta in the Herring guiding symptoms. So now we have two groups: those who are relying on the Puritans group, and those who are relying on the this whole and the more vast group of symptoms, which is given by Dr. Herring in the Herring guiding symptoms. Now the main problem was many homeopaths at that time was converted homeopaths. They are not much acquainted with this, the whole lengthy process of understanding and mesmerizing mathematica. That's how, and it was not easy to memorize this sort of information. So there was homeopath, Dr. Lippe, who had condensed this all information in very practical way. He came with the some symptoms which are more applicable, more confirmed, and more reliable in the practice. So Dr. Allen went to Dr. Lippe, because at that time that was a diphtheria epidemic, and he saw that Dr. Lippe was prescribing in many cases only one drug, and the patient is getting cured. And at that time, was a very big thing, because many of the converted homeopaths were practicing the polypharmacies at that time also. And to see the man who is practicing so effortlessly and so fluently, and he went to there and he saw that in the epidemic of diphtheria, in where Dr. Lippe was before the diphtheria in the house, diphtheria never reached there. And if the diphtheria was reached before Dr. Lippe, it has the most shorter duration, and the recovery was 100%. So this was fascinated Dr. Allen, and he gathered the information. He read his keynotes, Red Light Prescription, Dr. Allen. It has a very nice book, Dr. Lippe. And from that, he got the idea. And then from this Puritan Mathemedica, from this herring guiding symptom, he collected the gems which are more practical, which are more clinically sound and clinically verified. And that's how he made the Allen's keynote. So the Allen keynotes we are reading is not just a book, it's not just a collection, but it's a gist of our Mathemedica of the most precise and most useful symptoms. Okay. So that's why the Allen keynotes has so much importance in our clinical practice. The Allen keynote, the full name is itself suggests that Allen keynotes and characteristic with comparison of some leading remedies of the Mathemedica. We have Allen keynotes also. The characteristic of the remedies are compared with the other remedies, and there are some vowel nosers also, which was famous at that time. Total, it has 188 remedies in it. But if you compare, many remedies are added in the suggestive sections, and that's why it can be more than 188 remedies. So there is a plan of how to study. If we have time, I will tell you that it is a many students find that it is very difficult to digest this Allen keynotes. Why? Because we don't remember the symptoms. We don't remember how it is been how to read it, how to memorize it. I will give you the simple way to read the Allen keynotes. If you look, each and every remedy in the Allen keynotes is arranged in such a fashion that it follows some certain pattern. For example, there are first few lines. What is in the first few lines? We will talk later. Then there are some next few lines. Then some pathological conditions are given, and then there is relation and modality. The most important part is relation and modality. Okay. So if you follow this pattern, the drug you read from the Allen keynote is much more easier to remember and much more helpful in the clinic to recall in the specific condition. Okay. For example, if we will talk about the first few lines. The first few lines in the Allen keynotes are the most important, which cover the whole gist sphere of action of the remedy. For example, if you then there are the next few lines which indicate the indicating cause, complaints of the patient, and the grand characteristic. Second, the pathological conditions or the clinical conditions are always with the location, modality, and the distinguishing characteristic feature. Just remember, I will explain it on the next slides. Then relation with the other symptoms or the condition or the concomitant. Next, then there is the relation and modality part. The most important pointer are in the modalities. Then guide to follow up or the selection for the second prescription is also given in the relationship problem. Now we will take the most common remedy, Naxomica, and we will explain how to read it. So first, if you open Allen keynotes, if you have Allen keynotes, the first few lines, if you carefully see, it is written how the Naxomica patient is. So if you have a patient, the Naxomica, it should be thin, it should be irritable, careful, and it should be zealous, which having dark hair and the bilious or sanguine temperament. He should have some blood issues or some acidity, so it should be thin and irritable, which is careful. Sometimes the patient came and said in the OPD that, sir, look at my reports. It is from 98. I have done this test. From the 90, I have done this test. 92, I have done this test. So carefully he has, and so zealously he will showing to the patient. Then and there you can prescribe Nux vomica. It should be irritable, thin. In the OPDs, the patients who quarrels a lot for their number, for their turns, for the other things are mostly Nux vomica. How you are taking that patient's note first and not seeing me, doctor sir? That is the Nux vomica patient for you. Second, that is quarrelsome, spiteful. Spiteful. He will never understand who is in front of him. That is the meaning of spiteful. What came in mouth, he can spit it. अरे आप कैसे डॉक्टर हो, ऐसे कर रहे हो, ऐसे कर रहे हो? How you such a big doctor and you don't have this management for the patients? How many time I have to wait for you? Malicious, nervous, and melancholic. So you can have the fairly a good idea of how Nux vomica patient will present to you in the first few lines also. Then they are debauchers. Because of debauchery, they will eat less, and they are the constitution weak. That's why they are thin. Because of this, they are always irritable, nervous. Because of debauchery, they are prone to indigestion, and that's why mostly the bilious constitution, they will suffer from hemorrhoids. Now here, Dr. Allen has compared that if this type of person came to you and it has light hairs, blue eyes, but we don't have that type of constitution available in our continent. But if the patient is not that much dark, if the patient is more good looking, had blue eyes and light hair, the remedy is lobelia. So now if a patient is thin, irritable, spiteful, malicious, with the dark hair, comes to you on the dark complexion, Nux vomica. But the same symptoms, the patient is different. Patient is having light hair. Patient is somewhat looking like phosphorus, but whole symptom are Nux vomica. And the remedy might be lobelia. And that's how he differentiates with the two constitutions, not within the two symptoms, but in the two constitutions. Like if you read Gratiola in Boric, it is written that the female symptoms of the Nux vomica in the female, the symptoms if of Nux vomica if presented in the female constitution, the most likely remedy is Gratiola. If you open Alan Boric, first paragraph, last line, you will see that it is a Gratiola because the patient is female. That's how we can differentiate. All the symptoms are Nux, but the patient isn't. But the patient is female, and she is not quarrelsome. She is not spiteful. She is not malicious. But the physical symptoms are there. She might be haughty. The symptoms are similar, but the sex is different. Then the remedy is Gratiola. So that's how you can compare and you can differentiate a symptom. Now we have 3 remedies for all these complaints. Okay, but that's how we can differentiate. Nux, again, Nux is chiefly successful with the persons of an ardent character, of an irritable, impatient temperament, disposed to anger, spit, or deception. And that's what Hahnemann is saying. Now, if we don't have the patient of ardent character and irritable, the patient must not be mathematical. So, in the first few lines, you will see a total picture how the patient looks, how he will present in the clinics, and which systems are affected in the patients. So if you see and if you read like this, now the picture of Nux vomica patient is confirmed in our mind. Now we will move to the next few lines where the indicating cause is given. In the case of nuts, these are bad effects of coffee, tobacco, alcohol, stimulants, highly spiced food, etc., etc. Okay. Then one of the best remedies which commence treatment of cases have been drug of mixtures, bitter vegetable oils, especially aromatic or hot medicine, but only if symptoms correspond. So he had given that when the Naxumika is much more indicated when this type of medicines are given and the patient is presenting the Naxumika symptom. If the patient is having this type of symptom, you can give Naxumika. And in the times of COVID, when the whole India was taking this type of hot medicines, कि भाई सर वो गरम दवाई थी, गरम दवाई थी, गरम दवाई थी, हमने वो काढ़े लिए, ये कैसा लिया, वो लिया, दिन रात वो we have taken that kadhas and all that to take to boost immunity. Immunity, I don't know how much it increased, but patient was surely suffering from acidity and piles and fissures. So for all these patients, we can give Naxumika because the symptoms, if the symptoms was corresponding, if the symptoms are something different, we have other two remedies, that is allosocotrina and tucram. If you read allosocotrina from the Allen itself, it will say the mode effect of the more drugging in, and the tucram. If you see in the boric, we have you will see in the first line that effect of much drugging. Okay, so we most of these peoples make a mistake that they say कि भाई कोई भी पेशेंट अगर एलोपैथिक से आया है, patient came from the allopathic background, start with Naxumika because to neutralize, to remove the bad effects of Naxumika. No, we have many other remedies to do that. That's why Dr. Allen said, but only if symptoms correspond. So we will see first the description of the patient, then what cause are there which produces the Naxumika symptoms. Then we have the grand characteristics. Grand characteristic is the symptom which is runs through the whole, we can say in the whole remedy. Most of the time, the grand characteristic is a symptom which will be the most useful symptom. Like convulsions, if you want to prescribe Naxumika in the patient of convulsions, it should be the patient have convulsions with the consciousness and which is aggravated by anger, emotion, touch, moving, etc., 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 etc. Whatever may be the cause, whatever may be the situation, whatever is the diagnosis, if the patient has convulsions and that too with the consciousness, the remedy is Naxumika. And that's why the grand characteristic is so important, which is given just after the causations. Second is tendency to faint from orders in morning, after eating, after labor pain. If the patient is fainting a lot, with the in all these case with the all these causes, the remedy is Naxumika. 101% it is Naxumika. Okay. Now we have patient's constitution, we have the causation, then we have the grand characteristic that if this comes, if the patient faints, the patient is Naxumika. Now we will move to pathological conditions. Pathological conditions are where some pathological conditions are given with their proper concomitants or the proper what can I say, with the modalities sometimes. For example, if you want to prescribe Naxumika for the backache, the patient must sit up and turn in the bed. Doctor Saab, I can't turn in the bed because of my backache and my lumbar pains. I have to sit up in the bed, then I have to turn, and then I have to sleep on the other side. 100% Naxumika. Whenever you see a patient of a fever and the patient cannot move or uncover without being chilly, I have to cover it. Please see Dr. my patient, my my child is having fever and he's covering every time he's covering. We as soon as we move cover, he will feel chilly. Naxomika. Next, the frequent desire to stool, anxious, ineffectual for a time after stool in morning, after rising, or after mental exertion. That, Doctor Saab, I have constipation. I have to go to the toilet for quite a few times, and every time I go, it's sometimes it's gas, sometimes it's stool, and I can't feel that it is cleared. Naxomika. Whatever may be the diagnosis, the patient, if the patient tell you these symptoms, 100% the patient is Naxomika. Then alternate constipation and diarrhea like this. So the pathological conditions are given with the some specific instances, with the some specific what can I say, concomitant, and with some information. So if you see a backache patient which have difficulty in turning up in the bed without sitting up, the medicine is Naxomika, with the irritable constitution, with the spiteful and malicious nature, and with the if the patient has some this type of causations in the background. 100% the patient will be Naxomika. Next, then there are relations and modalities. Complementary to sulfur. After you give Naxomika, the patient has starting to give eruptions, then we can think of sulfur. And if we give Naxomika, but the patient didn't respond, we have to give platina. If the platina fails, we have to give plumbum. Okay, so that's how the plan is also given. Okay, what to do next? If the patient's constipation, it seems like Naxomika, but the Naxomika is not working, we have to give platina. And if the platina is also not working, then we can think of plumbum. So that's how the plan of management is also given in the relationship and modality chapters. Okay, so that's why that's how we can read Alan Keynos. Now, next time we will read Alan Keynos, read in such a fashion, and you will remember that how beautifully we can remember. And if you are with me, now we can tell whole picture of Naxomika. Just the Naxomika patient, it is thin, irritable, spite, malicious, who is suffering from sanguine and bilious complaint, who is quarrelsome, who is dark hair, then who has debauches, whose causes are tobacco, vegetable oils, pills, hot medicine, who faints a lot, which have if the patient has convulsions, the convulsion should be with the consciousness. Then next, the patient, if they have the backache should be with the when the patient has to sit up and turn, ineffectual urging of the stool. Then there is alternate constipation and diarrhea. Then patient is when the patient is getting better and the eruption came, or the case is not moving forward, we have to give sulfur after Naxomika. If the Naxomika patient fails to improve, if the constipation like Naxomika failed to improve after giving Nux, we can think of platina. Still platina is not working, we have to give plumbum. And now you had memorized whole picture with the help of Alan Keynos. And now I think you are feeling quite easy to read Alan Keynos, and you can think that it is very easy to remember the picture like this, and we can now correlate it more easily when the patient will come to our OPD. Okay, so patient came, we will see, अरे भाई ये तो थिन है, अरे भाई ये तो इरिटेबल लग रहा है, बाहर अभी भी झगड़ के आया है पेशेंट को, क्या हो रहा है? Doctor Saab, I have this type of constipation. I go for the stool. I didn't pass the stool. Sometimes I pass the stool. Sometimes I didn't pass the stool. I have to go frequently to the stool for the toilet. And still I didn't feel like I have completed. and I used to drink a lot. I used to have this khaini and this tobacco, and now have this type of symptoms. I have to take this churans and this type of some type of isabgol to for a night to clean my bowel, and now they are not working. Simply Q Naksumika. How much time we will have? Only 1 or 2 minutes. No need of taking so much 2 or 3 pages of history, after that reportization, after that so much interpretation, nothing. You saw the patients coming, patient sit, patient have this type of character, this type of symptom. Simple. Okay. So that's what I do in my practice. So we start with the case. This is the case which came to me. Simple case. We will go from the simple case to the some pathological cases. How it can be done with the help of Allen keynotes. I remember a case of my practice. Where I share this case a lot with in many seminars and many lives, because that was one of my first case which I solved with the Allen keynotes. Okay. I was a new practitioner in my town, and just 1 or 2 month old, and a patient of factor VIII deficiency came to me, and that was referred by some doctors who was far away from there, who was the patient was taking treatment for him, and the patient was not in condition to go there. So he referred to me. Okay, the nearest doctor is there. You go and you take the medicine, I will say. The patient came and said to me, and he had this much large uh, uh, cloth in his mouth, and he was not talking. Her mother gave the history that since 1 or 2 years we are taking medicine from that doctor. And yesterday, my son had a fight in the school, and the boy uh, punched him. And he punched him so hard that her tooth fell off. And after that, because of he is having factor VIII deficiency, the blood is not coagulating, and since night he is having bleeding. And to stop the bleeding, since night he had put that big cloth in his mouth so that the bleeding should be stopped. But whenever the cloth is removed, the patient start bleeding, and we don't have money to give factor VIII. Doctor Saab, please help. And that doctor is also some few 100 kilometers away. We can't go there. You have to help us. And how? And I was in shock. What can I give him? And then I tell the patient, just talk to me and just show me whatever. He removed the clot, and the bleeding starts coming. He just show me the cloth, and there was so many clots on that cloth, because it's from it was there constantly, so many clots. And he again put it because the bleeding was so heavy. And if you have seen a factor VIII deficiency patient, if it bleeds like a hell sometimes. So I was thinking, and I just gave him a remedy. And I told them, take it every hourly and call me tomorrow what happens. And after 4 or 5 hours, I saw the patient at 1 or 2 p.m. and at 7 or 8, I received a phone that Dr. Saab, the bleeding is completely stopped. My son is now able to eat, because due to this bleeding, he hasn't eaten since last night. Now the bleeding has completely stopped. He has eaten and he is very good. So for this factor VIII deficiency, the bleeding, the emergency, and the nothing, not any symptoms were there. But if you open, or if you open till um, uh, आपकी Mr. Remedy, in the from the first case, and what is the book? Okay, if you open this trillium, if you open trillium pendulum, you see in the first page is that extravasation of blood from the extracted tooth. The tooth was extracted because of the injury. The patient had this clotted bleeding, and I give the patient the remedy, trillium pendulum, which we normally use in the cases of metrorrhagia, where the patient has severe backache and the bleeding was in the clots. Okay, so that's how we can treat so efficiently. I had nothing to be nothing history, not any 1 or 2 pages of symptom. It was then and there. We have to prescribe then and there. The next case I remember was a case which was referred to me by another homeopath. The case was of diabetes insipidus. The patient used to drink. The patient was a 3 or 4 year boy, which was suffering from this diabetes insipidus. In that, the patient used to drink 5 to 7 liters of water at a time in a day, and he has to go for the toilet very frequently. Because of this, at night he used to drink sometimes 2 or 3 liters of water, and he has to go for the urine. And the parents were so much disturbed because they're not getting the sleep, because after every 1 hour the diaper was full. The boy will wake up, mummy, the diaper is full. Sometimes it will get overloaded, they have to change it. Sometimes sometimes they have to go take the boy to the loo sometimes, and it was a total mess. 7 to 8 times in night they have to wake up, change the diaper, or sometimes they have to take him to the loo, because, and after every time he passes urine, he will drink a glass of water. That was the severest condition. Endocrinologists suggest that they have to be given that they are starting some drugs, and the patient will be like this in whole of his life. And they consulted many homeopaths, but they didn't get any success. And when they came to me, they were totally exhausted. I also gave the patient, after initial case taking, I gave him Brinia, I gave him silica, but the patient, still the patient was not improving. And the patient mother came to me at the third or fourth consultation, because the patient was not getting better, and said, Doctor Saab, we are so much fed up. क्या हो रहा है, समझ ही नहीं आ रहा है. We are so much fed up. How to deal with it? 7 से 8 बार, 7 to 8 times I have to wake up at night. I am not getting sleep. His father is not getting sleep. He will sleep in the day, but we have to wake up. And at that time also, her diapers gets full. What to do? What to do, Doctor Saab? And we are so much, but कितना इतना सुसु कहाँ से लाता है ये? जितना डॉक्टर साहब जितना पीता नहीं ना, उतनी बार सुसु जाता है बोला. एंड दैट वाज अ स्ट्राइकिंग सिम्टम to me. मतलब क्या बोला आपने? Just repeat. So Dr. Saab, he went for the toilet so much time that I think that he didn't even drink that much of water. If he drinks 5 ml, 500 ml, he will. I think he passes 1 or 2 liters. मतलब how this is possible? No, no, doctor sahab, this is the case. He will drink half or one glass of water, and he will pass so much water that his diaper will get leaked. And we are so fed up. And then, well, is it 100%? Yes, doctor sahab. And we are so much fed up, so much fed up, so much fed up. Well, okay. And I ask him that how he sleeps. Well, he sleeps like this, like this. Does he salivate in the sleep? Well, yes, doctor sahab. Does he has offensive odor in his sleep from his mouth? Yes, doctor sahab. After I brush him, he still his mouth is mouth breath is offensive. Well, okay. I gave him a remedy, and within few times and few days, the patient start improving. And the remedy which I gave him was Merksol 10M. If you read in the left hand side of Allen Key notes from 4th or 5th line, the urine pass is more than he drinks. Like this, it is the line. If you see Merksol, left hand side page, it is written. And I just confirmed it with the characteristic symptom of Merksol. As we all know, Merksol patients salivate profusely at night. As we saw, the Merksol patients have offensive odor from their mouth. Now, I prescribe Merksol 10M, and till date, the patient is fine. He is devoid of all this, all the drugs the endocrinologist suggested him, and the patient is absolutely fine. I gave him Merksol 10M, 50M, and a dose of pituitary after to end the treatment. But that was the key point. That was the entry point on this case, that patient patient has to go to urinate more. Patient urinates more than he drinks. If you see in the Allen Key notes, it is the symptoms written. Sometimes patient आपको बोलेगा, sometimes the prostate patient will say, Doctor Saab, I drink less, still I have to pass urine 4 times, 5 times, 6 times, 7 times. I reduced my water intake, Doctor Saab. Still it is that I have to go for urination quite a few times. I didn't drink that much. And in that type of case, you can always think of Merksol. We sometimes neglect this type of cases. Ke bhai, chalo, this is a common symptom. This is a common symptom. Just inquire how much quantity you pass. If you say that I pass a quite satisfactory amount after every time I go to the toilet, you can think Merksol in benign benign hypertrophy of prostate, and the results are marvelous. Many times, if the patient tell me these symptoms, I will give the Merksol in BHP cases. Okay. So that's how Allen Key notes helps us. Sometimes it will help to prevent the future conditions also. For example, I had a case of severe rheumatoid arthritis. The patient had taken the treatment from every possible doctor, and his hands was like this. Total swan neck deformity. I asked him many things, how it started. So he tell me that before that he used to get cramps. Doctor Saab, before now this rheumatism started. Now I used to get cramps in my hands. I had to get this cramp while writing, or something like that. And after some times it has started, and now I have this deformity, this contracture I had. Well, okay. I asked him any history of any diseases, and he said that I had a severe diarrhea in my childhood, and that went for something 5 or 6 days. I have to get admitted. बहुत सारे IVs भी लगे डॉक्टर साहब. After that, and I was pretty much weak for some times. If you see in abrotanum, first page, 7th or 8th line, it is written cramps in the parts before the colic or contracture. Cramps or the colic before the contracture. It means if a patient came to you that bhai sir abhi aisa ho raha hai, these cramps are coming, be rest assured that sometimes after some times, because of this, he may land in the contractures like rheumatism, like RA, like this. I gave him the abrotanum because the patient has also had the history of checked diarrhea. So these two symptoms guided us to the remedy abrotanum. We never think of abrotanum like this way. So many patients tells us, sir, ye cramps aate, cramps aate, cramps aate. And we never think of abrotanum. If we give abrotanum at that stage, the patient will never land into this type of severe pathologies. So everything is written in the Allen key notes. We have to understand it. So I had this, see, we have a simple case, on a busy day, a patient of this wart on his hand came to me. The history was taken by my assistant, and he said that we had removed it surgically 2 times, but it again came. It was small growth, pain होती है, pain होता है उसमें से whenever I touch it. Okay. And then the other symptoms, patient had this type of desire, sour desire, chicken desire, tandoori. He was tandoori roti, tandoori chicken desire, thirsty patient, hot. Nothing peculiar. Okay. So I just told my assistant, okay, simple case. If you open Natrum Mur, right hand side page, third page, you will see warts on the palm. Simple. If they are more sore to touch, then we have natrum calm. Because the patient has thirsty, patient didn't have aversion for milk, we went for natrum Mur, and I just tell the patient, okay, bhai, just open your mouth. The patient had this ringworm on tongue. If you see here, patient had ringworm on tongue. That was the observation. Okay, so Natrum 30 was prescribed in water doses, and after, I think, 3 or 4 weeks, the whole what was vanished, and it didn't appear until now. No sign of warts before it was here. Now nothing. Simple. Patient didn't had the desire for salt. Patient didn't had any headaches. Patient didn't had any history of grief. Still, if you find this keynote, wart on the palm of the hand, if they are so to touch, natrum calf. If they are still painful and patient is have the other symptoms, give natrum mur. Okay. Now the another case. So that's how we can differentiate warts on the face, flat warts on the face, Dalkamara. Okay. Warts on the face, flat spots on the face, salivation, Dalkamara. Warts on the nose, causticum. Warts on the neck, face, more cauliflower side, thuja. Warts which are very itching, sabina. Okay, so we have this type of range of symptoms, range of differentiate symptom in the Allen key. If the patient has warts, if the patient has warts, they are itch before they came, sabina. Okay. Next case. This was the case of lyconoid dysplasia. Those who know, lyconoid dysplasia is a precursor to cancer. Okay. If you see the biopsy report, that it is written that the lyconoid dysplasia has a true malignant transformation potential. Recommended follow-up, recommend weekly follow-up of the patient. That patient should be followed weekly because the patient had risk of it developing it into cancer. Anytime it can develop into cancer. So weekly we have to follow up. The patient was fed up. Patient removed this mass in his mouth quite a few times. Though say 3 bar, they had removed it. They had taken so much medicine. Since 3 or 4 months, he has taken medicines for this, medicine for that, medicine for sometimes any other medicine to remove it. Sometimes it had he had another medicine. One doctor gave him that remedy, doctor gave that medicines. He removed it quite a few times. That's why he have to consume a lot of antibiotics 2 or 3 times. And now patient is completely fed up. He came to me with this condition. I took the case. Patient was, there's ulcerative growth. Patient was chilly, thirsty. Patient was fastidious. Patient had very irritable, black, thin patient, history of alcoholism, history of tobacco chewing. And with this long history of medicine, and the patient has this sleeplessness. Once awakened, the patient cannot sleep. Okay. History of chills with fever. So many times he had fallen ill. And the remedy we gave was simply Naxomica. So after the first follow-up, the mass had shrink. So we continued the medicine. After that, again, what you will see, there is inflammatory changes are there. It means that Naxomica is now not that much helpful for the case. So the next, we move to psychotic conditions, which are on the left side, here on the pinna, black patient, recurrent tendency for urination. We will have our remedy, Thuja. So we give Thuja, and after few times, the whole lyconoid dysplasia went away. If you read Thuja first page, psychotic manifestations in the mucous membranes or other parts with the corresponding symptoms of hairy pinna, increased urination. And the disease which is not going by was been cleared with the simple doses of Thuja. Okay. So that's how Allen keynotes help us, because sometimes the case of Naxomica, we open the case with Naxomica, and then because we will going the forward in the case, we will see that now the changes are again recurring. So now we have something to give to patient as an anti-miasmatic. That too is given by Dr. Harry. When you give arnica to a patient, if he had trauma to the ovaries, to cure that, Dr. Herring suggested Soranum. If you open Soranum, after the arnica had done the work, Soranum will cure the case in trauma to the ovaries. And you will be astonished कि भाई ऐसा कैसे होता है? But that's true. You are giving arnica, patient is better, but the patient is not getting better after that. You will see the magic with the Soranum. Many times now we have the epidemic of cough coryza everywhere, I think. most of the children are coughing, like coughs a lot, dry cough, dry cough, dry cough. Patients are the children are getting more paroxysms at night. And you see, many times you give Drosera, but Drosera didn't help completely. Okay. So you are doing Drosera, patient bola, okay, my son is better, but the cough is there, doctor. He's not 100% better. So if you read Sina in the relationship, you will see when the Drosera has relieved the symptoms, Sina will cure the case. Simple. Simple. What happens? Drosera, if you give Drosera, patient ठीक है, but patient is not getting better, then we will shift to the another remedy. We will give Bryonia, we will give tuberculinum, due to some his tubercle parentage, sometimes we give spongia, and we will mix up the case, and the patient is not getting better. Patient is overdrugged. In that case, simple Sina, simple few doses of Sina will help the patient quite a lot. If the patients had come with us, Dr. Saab, I had these wards removed and burned so many times, but it's still they are coming, still they are coming. I had burned them quite a few times, still they are coming. For this, if you open Natrum right hand side page, you will see bad effects of cauterization by silver nitrate, but you can take it as a cauterization and start the case with Natrum. Many times the patient will be cured with the few doses of Natrum. So beautifully it is written. So now, so moving on to the next case, this is a case of eczema, so much bad, and it was on the whole leg, and the patient has taken allopathic medicines quite a few times. It goes and comes again. Went to some homeopaths also, but it's not getting better. So he came to me for this eczema. I I inquired him, Doctor Saab, ye, it came in every winter. I have to take it. I have to take the medicine every winter because it came and it flares up in the winter. I went to so many allopaths. They gave me so many medicines. I went to many homeopaths also. They gave medicine, but it didn't goes. If it goes, it comes in the next winter. So I asked him, what was his desire, aversion, like that? And says, stool. Doctors have stool. I have this mucus stool. I have this complaint of dysentery since so many times. Anything either is if I change the diet a little bit, if I eat from anything, I develop this mucoid stool. So I gave him a remedy, and the whole eczema cleared up within 15 or 20 days or 1 month. And the remedy we gave was allosocotrina 200, only one dose. And with one dose, he was so much better. If you see Allen keynotes, left-hand side page, itch appears in every winter. Itch appears in every winter is allosocotrina. And the too much drugging he is having since so many times, every winter he has to go to the dermatologist, every time he has to go to the homeopath. So the too much drugging plus the mucoid stool. And with the one dose of allosocotrina, the patient is better. Next. This is a case of ulceration going towards the gangrene. Okay. So this was a patient of diabetes who was suffering from diabetes, who walked for some 10 or 20 or 5 or 10 kilometers to a pilgrimage. And after that, he developed this type of ulcerations, and then it went to become gangrene, and it was not healing. The allopathic medicines are not getting, not showing any results. And this was not my case. This was a case of my one of my colleague, who shared me this pics, that this was the first case, and after that, now it is becoming worse and worse. Uh, can homeopathy do anything in this case? So I inquired in, and we prescribe a remedy called carbolic acids in 30 potency water doses, and ask her to inform me after 5 or 7 days. And after 5 or 7 days, the whole granulation tissue keep coming, and the wound is healing very nicely. If you see carbolic acid left hand side page, it is written that physical exertion, even much walking, brings abscesses in some part. Pains terrible, come suddenly, last short time, leave suddenly. That was the case. That first it was abscess whole there, then because of it, it was diabetes, it was converting to the gangrene. After carbolic acid, simple physical exertion brings on the abscess. All the acids are very much important in the treatment of diabetes. Remember. Okay. So that's beautifully, you can cure these pathological conditions also. Simple. This is the case of erosive lichen planus, which was referred to me by my one of the renowned dentists in my town, and they told me that, Ranjan, we are we tried everything, we have done everything, but it is not getting. The patient is in severe pain. Please, if you can do it, just tell me. Well, sir, just send the case. We took the case. That was the condition. Patient cannot eat. Patient has this type of ulceration in his mouth. If you see how deep the ulcerations are, patient was in pain. Patient came to me, their redness, posterior passage, hard palate, gums. In the gums, it was itching. The patient has so much salivation. Patient has so much hot feeling. Patient can't eat pungent things. He has to have liquid. He was on the liquid diet, and the patient, every time the patient, uh, 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 when the patient start talking, na, uh, patient was talking like this. This was fever. After that, we go to that the doctor, and then we give that this medicine, and then I was falling ill, and then they put it. But please, uncle, can you talk slowly? I can talk this way. There was so much hastiness in the pitch. We were talking very hurriedly. We took the symptoms, and simply we gave Merksol. Nothing fancy, nothing any uh, interpretation. If you open Merksol right hand side page, ulceration, deep, with salivation, caries on the gums, which are very painful, which aggravated at night, salivation, and the hastiness in the speech. If you read Allen keynotes, it is also linked the hastiness in the speech. Left hand side first line, if I remember correctly. And after few doses and few months on Merksol, 0 by 4, 6, 10, the whole ulceration went away. The dentist was so much happy. After that, many cases of this erosive lichen planus, of leukoplakia, he's sending to me, and we are treating it together, and the best results we are having. In the cases of leukoplakia, we are having best results. That patient was solely on homeopathy, because allopathy is not working. Nothing. Simple case of Merksol, and the failures of allopaths will turn the success of homeopaths. Next, this is a case of our recurrent fever. We will go in the later chapters of Allen keynotes. This was a patient who have was suffering from body ache, fever, pain in neck, weakness, chills, wet. The all symptoms started after getting wet. He was admitted in the ICU. He was treated like COVID. He was suffered from pneumonia, and uh, after that, uh, he was got better. He came to home, but after that, every week he has having these episodes of fever with chills. Every time he will go and he have fever and chills. He have to get admitted for 2 to 3 days, high grade fever with chills, not responding to the simple paracetamol. They have to get admitted him. They do IV, give antibiotics, antimalarials again and again, and the patient was totally fed up. They consulted me. That was the symptom. Patient was so much chilly, and he said that I'm suffering from this fullness of abdomen, doctor sahab, whenever I get this. That was the history. Nothing peculiar, nothing. Now, if you have body ache, sometimes I have body ache, sometimes I don't have. Nothing peculiar. We gave him malaria office analysis. Chills, recurrent fever with the fullness of abdomen, desire for sweet. That was the prescribing point. If you go in the letter section of Alan Kinos, read malaria office analysis. After that, he came for 1.5 months only. And after that, since now, he never had an episode of fever, never been admitted, living his life fully, and he came to me for his grandson. And every time I see, I tell him, do you have any something? Uncle ji, do you have anything? But no, doctor sir, I'm totally fine. After the medicine, I'm totally fine. Simple case of simple. If you see in that case, we have chill, we fever, but we don't have bitter taste, we don't have desire for sour. So the chana is ruled out. We don't have this restlessness. The patient was more dull. Tox is ruled out. We don't have headache. We don't have these symptoms. Patient was having perspiration, thirstness, body ache. Perf is ruled out. Now, the only remedy was remain malaria office analysis. So, that was our prescription, simple, and the patient was rid of everything. Next, it is a case of severe RA. The patient was suffering with so much, the RA factor was 207. Whole, what can I say? The whole joints were swollen, painful, legs, stiffness, knee pain, appetite was low, acidity, eructation, gurging. Patient was chilly, thirstless, sleeplessness. All the complaints started after the husband had expired. Patient wants to be alone, irritable, ignitia, in LM potency was given on the history of grief. But if you read the first few lines, the patient was so much active. Patient was decisive. That's why he was doing his course. If you read first few pages, first few lines of ignitia, you will have the clear-cut differentiation of ignitia and pulsatilla. Though the patient was weeping easily, the patient was dark, patient was lean thin, definitely decisive, hurried in manner. If you see and if you read ignitia first few lines with the contrast of pulsatilla, which is fair looking, indecisive, weeping, and mild. So the ignitia in LM potency was given, and after that, the RA factor was 207, came back to normal. Okay. So as Dr. Hahnemann told us that when you have to do with an art whose end with saving of life, any neglect to make ourselves through master of it becomes a crime. If you have so much power in your hand, if you have so much ability in your hands to cure the patients who are suffering like hell, who are not getting better with any other treatment, and if you have this uh, what can I say, this power in your hands, and if you gift in your hands, and if you are not trying to master it, then you are a criminal. And for this, uh, Alan Keynotes helps us to make this uh, job little bit easier, a little bit uh, fun, and that's all from me. Uh, thank you so much, and over to you, ma'am.
Thank you so much, sir, for this wonderful session. And I would like to raise the question that we have in the chat box. So, shall I?
Okay, no problem.
Yeah. So, uh, Yashwardhan Jain asked for the potency. How to decide the potency?
For the potency, I will say that the susceptibility is very much important, and I have a simple rule. If the patient is having a rapid progressing disease, stick with the centesimal potencies. If you have the progressive diseases, go for LM potency. Higher the susceptibility, go higher. If the patient has lower susceptibility, the changes are pathology changes are more. You can start with the medium to low potency and then gradually increase it. Mostly I use uh, 50 millisieverts potencies in the pathological cases, so that you can manipulate and you can control the doses and the reactions after the if you after you administer to the patient. And it's quite easier to look the progress and to control complete to have a complete control on the any aggravations if it develops in further increasing in the potency. So I use it like that way. Nothing, no rocket science. Simple. What Hahnemann has told in the Organon of Medicine.
Sir, there's another question. In case of words, one should start with low potency or medium.
No, it depends on your experience, on your skills, on your knowledge. If the patients have given the clear-cut picture of the remedy, if he has then you can go for the higher potency. First of all, the posology is the most debatable and the most controversial point in homeopathy. So the doses we administer is not because it is written like that way in allopathic pharmacopoeias or in other pharmacopoeia. They have clear-cut indication for the doses. We don't have that clear-cut indication of the doses, how much you have to give, how many doses are the minimum doses, which dose is minimum. For some patients, it's 3 doses are minimum. Some patients, 10 doses are minimum dose. For some patients, only single dose, that too in the water doses are minimum. So the posology is very much debatable. Most of the homeopaths are prescribing on their experience-based knowledge for this dosing. If you say boric also in his preface said apologize that the doses are not. I can apologize for the doses. You can uh, choose your, but this is my experience. So it is not a hard and fast rule for the doses. The safest rule is start from a low or medium potency if you have centesimal scale, and then gradually go higher as the dose exhaust. It's all written in the 5th edition of Organ of Medicine. If you want to use LM, go 1 by 1, 0 by 1, 0 by 2, 0 by 3. as it is written in the 6th edition of Organ of Medicine. Simple as that. Okay, don't use any heroic way to treat your patients, because sometimes you will land in trouble. So for the beginners, I will say go for the first 5th edition if you are going to prescribe in some pathological cases. Medium to high potency, step by step, add the dose, exhausts, and in an LM potency 0/1 by 0/2 as the cases progress with the caution. Okay, so that's the simple rule. Nothing else.
Thank you so much, sir. Another question, that itch coming every winter, as per the case in we discussed of Aloe. So itch coming every winter is a disease symptom of every skin disease. So how do we differentiate between the disease symptom and the individual symptom?
First of all, it is not a disease symptom. If it is peculiar, we have so many remedies, some few remedies for these conditions. Okay, like petroleum, graphite is like this. Okay, sometimes the eczemas are periodicals, no doubt. Okay, how they are presented to us, this is more peculiar, because every eczema is not same. Some are dry, some are VP, some are having discriminating, some are scaly. So you have to differentiate on that. In this case, the patient have this dry eczema, okay, and the patient is hot, but it aggravated in the winter. After that, he is suffering from the mucoid stool. Okay, this is the indication of allosocorina. If the patient is having heat of palm and soles, if the patient is irritable like nux vomica, if the eczema is dry, scaly, bleeding, the definite remedy is petroleum. If the patient is fat, fair, flabby, winter aggravation, cracks with the oozing of moist liquid, fastidious patient, the remedy is graphitis. Okay, so it's not that what the diagnosis, it's what the patient is representing to you. Yes, there are many common, it is a common modality of eczema, but it is the prescription is not on solely on the periodicity, but for the whole case, that the patient is overdrugged, patient is having mucoid stool, still the patient is hot, and now you are giving them allosocorina, because we are having because many before me, he went to the many homeopaths also. Everyone is giving him graphite, petroleum, sulfur like this, soranum. But we have to take the other criteria in mind also. Okay, so for the periodicity, for the differential, for the disease state, the aggravation in the winter is not important. What important is how the disease presented to you. That is more important. Okay.
Thank you, sir. Next question is by Dr. Osama Ali. Suppose in a case when we prescribe and medicine did well, but doesn't cure the case completely, how could we know whether to give the same medicine in higher potency or to give complementary or some related medicine?
It is if I want to say, the most expansive commentaries on the centesimal potency in their application and their outcomes was given by Dr. Kent in his 12 observations. Okay, he was the master of centesimal potencies, because he used to prescribe from the medium to higher potencies also. He was the one who introduced the higher potencies in the homeopathy. And according to him, if a medicine is given in the potency, it's not better. If you repeat the potency again, and it is not working, raise the potency. If still is not eating again, then you have to increase the potency. Okay. And if it has been acted beneficially, but it is not progressing, then it is the time to have some complement. A second prescription has to be done. It means you have to give a complementary remedy if you have to bring up a nosode or like that. So here's a simple way. Read Kent, because Kent has given the main fundamentals of application, and the outcomes given came after the application of medicine. This is not found in LM potency. LM potency is still in work to be discovered, work to be done. But for the Kent, it is very clear cut that if you give, read his 12 observation, you will get your answer correctly.
Thank you, sir. Next question is by Dr. Rubina. Differentiation between natrum carb and natrum mure in warts.
Natrum carb and natrum mure, mostly both are close remedies. In the wards, it is mostly we can say that the other symptoms will differentiate. If you open natrum mure, na, if they are sore to touch, they are also natrum carb is also written. But the other symptom, aversion for milk, thirstlessness, weak ankles, and other symptoms differentiate with the natrum mure. Nothing else.
Next question by Dr. Deepthi Prajapati. How to give 30 potency in water administration.
Okay, so water doses are something which are very fascinating to me, which after I came to in contact with Dr. Pradeep Gupta sir and Dr. Ritesh Sharma sir. And after that, I read Dr. Hahnemann's organ, sixth edition again, and I found if you see in sixth edition, he always advocated the water doses. Always advocated the water doses. First, in the fifth edition, he was more so of dry doses, less repetition, wait for the exhaustion dose. And the sixth edition, it is more of water doses. So for me, water doses are the game changers. First, it is a very simple procedure. Take a 100 ml of, take a PET bottle of 100 ml, put a freshly medicated globule of that potency, only one globule, and give 2 strokes and repeat it according to your case as the case requires. If it is a centesimal, if it is LM potency, 1 globule in 100 ml of water and give it to the and 10 strokes. For the sake of viability, put some plain alcohol so that the medicine can last for 15 to 20 days like that. This is a simple way to administer water doses. Okay, in centesimal also, in LM, we have this globule, but for this centesimal, we have to make just 1 globule, medicate it, put that in the bottle, just finish, nothing.
So next question is that Merxol and Mercuries are given separately in Allen's keynote. So are they same as you mentioned, or
Mostly they are same. They are the same. They are nothing different. Just like Bacillinum and Tuberculum are given in the same heading, the Merxol and Mercuries are the same, but just the preparations were different, and now the preparations which was available there now they are not available in the market. So for Mercurius, we have to give Merxol, and they are mostly the same remedy also. They are no other कि Mercurius के करके कुछ अलग remedy आती है, Merxol का कुछ अलग remedy, nothing. They are one and the same. The preparations were different, but we accepted the more feasible one, which we can produce in our laboratories, in our pharmaceuticals with quite safety. That's why Merxol is given. So we can take it as granted Mercurius and Merxol are the same. Okay.
remedy for eczema on dorsum of the foot?
There are many remedies. Meserium है, hydrocotyl है, both remedies. We didn't practice like that. First of all, if a patient has symptoms, the characters of that eczema, we prescribe on that. We don't prescribe like they give dorsum of the hand, but dorsum of the foot or dorsum of the hand.
Dorsum of the foot.
Foot. There are only graphitis, petroleum, but don't practice like that. Practice like what the patient needs. If the patient needs graphitis, he will be receiving graphitis. कहाँ पे भी eczema हो, कोई दिक्कत नहीं. Don't practice like that. 100%. कि भाई यहाँ पे है तो सेपिया है, यहाँ पे है तो पेट्रोलियम है, यहाँ पे है तो आपका vial order. No, nothing like this. Take the whole patient and prescribe on that.
Thank you, sir. Next question is for renal calculi cases, stones, which are settled in mid-calyx. It's difficult to come out. How to handle such cases? Have you treated any such cases?
Where the patient, again, can you repeat it again? Pardon?
Mid-calyx.
Mid-calyx for the removing. For it is called the many times there are two main conditions. If the stone is larger in size, that's why it is not passing out in it is forming the callus. So we have the remedy hydrangea, we have the remedy like bryophyllum, who are used for the stone breaking remedies. Secondly, most of the time we have the remedies like cardus mar, stone for the pushing the stones, and we have urtica urens, which have eliminating effects. If you read boric, for the eliminating effect. If you have to eliminate this type of symptoms like uric acid, like stones, you have to give urtica urens sometimes. In that cases, you have to do uric acid, serum uric acid of the patient, which we generally not do. Patient came with this. We didn't do of serum creatinine. We didn't do serum uric acid. We didn't do anything. We just give the remedy Barbary de do, ye de do, clear. No. Take what patient what is needing. Does he has low output? Give berberries. Does he have high uric acid? That's why the stone are forming. Give urtica urines. When the patient is thirsty, still the patient is having for tendency of stone. Isn't it peculiar that the patient is so much thirsty? Sir, why I'm so unfortunate. I drink 5 to 6 liters of water every day. Still I'm having stone. The reason is metabolic. Then the thirsty plant of Dr. Clark, that is hydrangea, came into the play. So you have to give like this. If you want to give mother tincture, that should be on the indications. If you want to give low potency, that should be on the indications. Indications are the key. Don't give it blindly. Ki bhai Burberry say left, Burberry say every stone will go Burberry. Nothing like that. It is mostly on left sided. Osmium sanctum, Osmium can is mostly on right sided. Sarsaparilla mostly on right sided. Tabacum is on left sided. Hidioma is on left sided. Ipumia is on left sided. Okay, Pereira brava, where you have this burning urination with the where the tip is more painful. That means the calculi are passing and it has lost somewhere in the middle of the urethra. There you give Pereira. So these are the subtle indications we have to give up. Okay. So if you have the mid-calculus, what is the size? Why it's not eliminating? You have to give these 3-4 minutes, and then you have to differentiate with this app. Okay.
Thank you, sir. Next question is, please brief about homeopathic approach for hives or urticaria.
Hives.
Yes, sir. Hives or urticaria.
Hives is a big topic and big uh, is a very large topic. But if you have a patient of hives which is aggravated by worm having gastric troubles, give lycopodium. If a patient of urticaria and hives, you if it's presented with the fever and constipation, if the patient is having constipation and if he's suffering from hives, you can give copaiba. If a patient has gastric troubles, if the patient has more thirst, give triostium. If the patient has the pressure urticaria, what we have called the whenever he scratches, the marks are open, then you can give Bovista. If the patient is drunkard, if the patient is having history of alcoholism and he is suffering from urticaria, give Chlororum hydratum. If a patient is having history of aggression by meat, patient is thirsty, patient is hot, patient is having eczema after he get heated up with after perspiration, give antim crude. If the patient is having urticaria and he has having this sometime kind of liver disease, his SGOT and SGPTs are very high. We didn't do any investigation in cases of urticaria. Sometimes the patient said that as I had doctor Saab and patient, you are not, the many medicines are not responding. You just do a liver function test of the patient and see if the SGOT, SGPT is high, then give Astacus flu. Okay, so these are few suggestions for the urticarias. If you have urticaria patient who is suffering from gout, you can give urtica urens. If the patient of urticaria is suffering from worms or the patient has history of worms, give urtica urens. That's how we differentiate and that's how we can give the remedy. These are the few suggestions. Then there are other after how it came and how it started out. Uh,
Thank
these are seems.
Next question is renal failure, EL serum, which potency is commonly used?
Most of the time, the 7x potency is quite beneficial. And if you want to give it as a eliminating or as a kidney supporter, but if the patient has the clear-cut symptoms of L serum, then you can give it in the 30 potency. It is more beneficial in that way. When the patient is had not edema, patient is having that renal failure, then it is more in the constitutional way. We have to give L serum in the 30 potency. Otherwise, if you don't want, if you don't have any indication, this renal failure hai, koi symptom nahi mil raha, and you have to give L serum, it is the 7x potency.
Next and the last question for the day. Approach for genetic diseases like Nonaka, in which myopathy occurs.
Myopathy occurs in the genetic diseases.
Yeah.
In these type of cases, mostly the point of origin, how it had developed. Many genetic diseases are developed after some trigger point in their lifestyle, in their journey. We have to find that, and we have to cover all the aspect. His genetic, his physical makeup, his mental makeup, his modalities, his generals, everything should be covered. That's how it can work. Nothing. These are the cases we are hard to crack. We have some cases like muscular dystrophies. We have DMD cases I have, which is going better. But for that, we have to take a very deep case taking, and we have to uh, find that cause, find that event from where it might be have started. Sometimes it not be there. So we have to consider the physical makeup, the mental makeup, the miasmatic picture is there. After that, we can prescribe. Okay, more in children's, in prior history is most important. So that's how we can go in these myopathies, and many times we have some marvelous results, and sometimes we have failures because uh, a clear pathway is not known for this type of diseases. We are still struggling, and I can see you. I can still that much I can say, because I am still learning from my cases. But this is how I am progressing in this type of cases.
Thank you so much, sir. I'll request our president, Dr. Shweta ma'am, to share her views about the session, though it had been so long.
Yeah, I would like to thank Dr. Ranjan for such an enlightening session. It was really fantastic, and you totally justified the topic and its practical implications with the beautiful case presentations. I hope it really help our practice, and for me, it was really wonderful and worth listening. I would also like to thank Dr. Niharika for suggesting you as our honorable speaker. Thank you so much, and we would definitely like to have you once again at our platform. Thank you.
Thank you. Thank you so much.
Thank you, sir. I would like to add that previously you mentioned about Dr. Sumit Paliwal, sir, and I was privileged to attend few OPDs with him during my internship days in my graduation. So I know how he handles it with such crispness, such prompt. So it was really
What I'm learned now, what am I learned from my gurus, Dr. Adhikari sir, Dr. Sumit Paliwal, because he was just a senior for me. After Adhikari sir, Dr. Adhikari sir has retired, he who took me under his wing and who trained me and who guided me. And still, whenever I feel some difficulty in my practice in life, I call him. And he's like my big brother guide, whatever you can told me, that I learned from these persons. Dr. Naveen Singh is there, if you know, doctor from Kolkata. He's one of the gem person. So I learned from all this, and uh, whatever I am from because of my gurus and because of my senior. And nothing what I am doing is nothing my person. It's a combined effect from my gurus and seniors. That I'm here
it
at
was
some
an
point in my life.
enriching experience hearing from you, and we
Yes,
would love to hear you again in our next.
Definitely.
Thank you so much, sir.
100%. Yes.
I would like President ma'am to present the certificate.
Sure. Congratulations, sir.
Thank you.
I would like to request our President Ma'am to share the vote of thanks.
Thank you. First of all, I would like to thank our honorable speaker for such a wonderful session. And I want to thank my executive team, Dr. Garima, especially for her continuous support and selfless service, with which we are able to continue our services towards homeopathic world and these webinars for the keen learners of homeopathy. I would like to thank our viewers and followers to join us today. I hope all the sessions we are arranging and organizing, they are up to their expectations. And thank you everyone for joining us today.
Thank you so much, ma'am, and I thank everyone present here today. And you can log on to our website www.dhma.in or contact us on 9711453617 for further assistance. And thank you so much for joining us today.
Thank you so much.
Good night, everyone.